Afternoon to all. Today we will discuss about the second part of general physiological changes after labor. General physiological changes take place in the form of vital, that is the vitals are vital are pulse, temperature, blood pressure, respiration. These are the vitals and pain also. So we will give the proper care to this vitals record. So first we will discuss about the pulse 50 to 60 beat per minute for 1 to 2 days after the delivery. But few hours after delivery pulse will be raised which settle down to the normal after 2 days. Second days pulse rate increase due to the pain and excitement. Temperature. The temperature will be 37.2 to 37.5 degrees Celsius or 99 degree Fahrenheit. Temperature raised after delivery 0.5 degree Fahrenheit but come down within 24 hours. Third day temperature may be increased due to the breast engorgement but not more than not raised more than 24 hours. If temperature raise after that, that show the sign of infection. General physiological changes. Blood pressure. It can be slightly decreased due to the vasodilatation or blood loss. A significant decrease in 20% below the baseline in blood pressure could be the sign of postpartum hemorrhage or septic shock. High blood pressure could be sign of the pain or preeclampsia. Respiration rate may slightly elevated due to the pain, anxiety, exhaustion, respiration rate also being to fall back to pregnancy level within 2 to 3 days. Weight loss. Weight loss can be 5 to 6 kg due to the expulsion of the product of the gestation and accompanying blood loss. Further weight loss of 2 to 3 kg can be attributed. Urinary tract. Bladder mucosa become oedematous and hyperemic, often show the evidence of the submucosal extravasation of the blood. Bladder capacity is increased. Bladder may be distended with pass of the urine. Common urinary problem which is occur during postpartum. One is the overdistension, presence of the residual urine, urinary stasis 50% cases में पाई जाती है. Difficulty in emptying of the bladder and risk of the UTI will be there. Now the changes in the gastrointestinal system. Increase the thirst due to the fluid loss during the labor, lochia, diuresis and perspiration. Constipation due to delay the mobility of the GI tract and mild ileus can be there. Perineal discomfort due to that of episiotomy and laceration and bruising during the childbirth. Anal incontinency, sometimes there is a anal incontinency, sometimes there can be a constipation. Fluid loss. Fluid loss at least 2 liters during the first week and additional 1.5 liters the next 5 weeks. Amount fluid loss depend upon the amount retained during the pregnancy. Weight loss continue up to 6 months after the delivery can be there. Blood volume. Immediate following the delivery, there is a slightly decrease the blood volume, return to the non-pregnant level by the end of the second week. Cardiac output raised soon after the delivery. RBC volume and hematocrit volume normal become by 8 week of the postpartum. Leukocyte to extent of 25,000 per cubic millimeter. Platelet count decrease soon after the separation of the placenta but increase the count after 4 to 10 days. Fibrinogen level remain high up to second week of the puerperium. The secondary increase in the fibrinogen factor 8 and platelet in first week. Soon after the first week, the risk of the thrombosis will be increased. Menstruation and ovulation. It is variable and depend upon the lactation. If the woman give the breastfeeding to her baby, the menstruation return by 6 weeks following the delivery in about 40% and by the 12th week in 80% of the cases. In non-lactating mothers, ovulation may be occurs as early as 4th week of the postpartum period. Management of normal puerperium. The immediate care of the mother, violet toilet, bladder care, bowel care, rest and sleep, position, diet, uterus, fundal height, early ambulation, postnatal exercise, minor disorder, postnatal examination, care of the vulva and episiotomy, care of the breast, maternal infant bonding, aseptic and antiseptic technique. These are the care which are given to the mother during the postnatal period. Immediate care of the mother. Observe the general condition of the mother. So vital should be taken half an hourly to know the general condition of the mother, and care should be given as mentioned in the third stage of the labor and fourth stage of the labor. Watch for bleeding. If present, then massage the uterus firstly and remove the clots from the uterus to reduce the chance of PPH. Make the mother comfort. Give her comfortable position. Give her warm and hot drink to provide the comfort, rest and sleep. Sedative may be given to for the sleep and rest. Provide the warmth according to the weather and need. Temperature. It is usually unstable during the puerperium due to the minor disorder. Pulse is slow in the rate 60 to 80 beat per minute. Rate can be undecreased due to the excitement and anxiety of the labor. Increase the pulse rate is sign of the PPH. If pulse rate will be increased, there is a chance of the postpartum hemorrhage. Vulval toilet. While giving the wash, principle of aseptic techniques must be followed strictly to prevent the mother from the getting infection. Sterile wash with the Dettol or other lotion should be given after 3 to 4 hours. Attention must be given to wound and stitches. Bladder. Due to the presence of the blood and plasma and tissue fluid during the pregnancy, the mother passed the large amount of the urine during first few days of the postpartum. Mother may has the retention of urine during this period because the bruising of the bladder neck and distension and the tone of the bladder lead to the retention of the urine. Mother should pass the urine within 24 hours. If not, then castration must be done. Bowel. Enema should be given to the mother can be plain water enema, saline water enema, Sophie water enema, and mild laxative enema can be given to the mother. If mother not pass the stool within 36 hours of the delivery, the mother is doing if not pass the stool within 36 hours of the delivery. If mother is doing well, if stool is passed, then there is no need to manipulation. If there is no constipation or stool is passed normally, so there is no need to manipulation. Rest and sleep. Mother must be adequate sleep. Ward must be quiet. Provide enough time to rest and prohibit the visitor. So if we want to give the adequate time to sleep and rest, so we will restrict the visitor, not allow the visitor before visiting hours. Thank you very much.